and we'll start with something which is usually not taught in medical colleges, and that is compassion and dignity. Uh, did you read about it in your undergraduate courses about compassion? Was there any course on compassion and dignity? Was it taught to you ever? Never taught to you. But these are some of the very basic things which are needed for healing, right? Not for treating. If you are giving a medicine to a person, that is, you are just treating the person. Here, when we talk of healing, which is a holistic thing, that means you are not just treating the physical body, you are treating the mind, the body, the spirit, the social factors, etc. So I'm visible and all of you can hear. Sure, the last benchers, can you hear me? Thank you. So as I was talking about these soft skills about compassion and dignity, these are so very important. If you really want to be a good physician, if you want to be average, below average, then it is fine. It really doesn't matter. But if you want to make a difference in the lives of the patients that you are, encountering in your professional practice, then these are the skills which you cannot do without. So when we talk of helping, fixing and serving. So what is helping basically? When you help, you see life as weak. I want to help this person. That means you are automatically putting yourself on an upper plane. So it is a work of the ego. When you fix something, again it is you are putting yourself on a higher plane. Oh, I want to treat this poor fellow. That means again it's a work of your ego. But when you serve, when you do service, you see life as a whole, and that is the work of the soul. So what you need to do is to serve, not to just treat, not to just fix. So there are so many definitions about what sympathy is, what empathy is, what compassion is. Right? Suppose you're going down a street and you see a hungry man, and you might say, oh, poor hungry man, and then you keep on walking. So when you say poor hungry man, you're acknowledging that the person is hungry and poor, but you're not doing anything about it. That is sympathy. But when you say, oh, poor hungry man, and he must be really hungry, he needs some food, that is your empathy. That is, you're recognizing and you're correlating with his needs. But when you say, poor hungry man, he is hungry, and let me get some food for him, let me feed him actively, that is compassion. So you need to transcend the first and the second level and go to the third level. Compassion, where you want to relieve suffering. Right? So this is a work of the soul. And then there is something called self-compassion. So in this hall, how many of you love yourselves? Please raise your hands. Oh, great. So many lovers. Now all of you who had raised your hands, go back home today and ask yourself the question again. Do you really love yourself? Have you really thought about this? Do you really love yourself? Have you judged yourself? Maybe the answers will change. See, you cannot pour from an empty glass. To give somebody love, you have to fill yourself with love. To give somebody water, you have to fill up your glass first. compassion is something like that. Unless you really learn how to love yourself, you cannot transmit that love and compassion to others. So this whole story begins with you. You are at the center of the existence. If you choose, you can make this world disappear. You can choose to ignore the world, or you can choose to be within the world. The choice is yours. So if you say that, oh, I am suffering, I have such a lot of problems, who is bringing the problems into yourself? It is you. You are choosing to bring those problems to your mind. Remember, you are always in control. It is you who is the chooser. It is you who is the doer. You are the boss. Remember that. Suffering. Now, is there anybody in this hall who has not suffered? Please raise your hand. You have not suffered? You have not suffered? Great. You still have a long innings to go. You are still young. Suffering is a basic necessity. It is actually a blessing in disguise, you see. We don't want suffering. But if there is no suffering, then there is no teaching. There is no learning. There is no growth. Because we suffer, that is why we keep on growing. We keep on learning. We keep on growing. We keep on understanding the suffering of others. We keep correlating. And that is how our compassion grows. A male person will never understand the intensity of labor pain. It is a woman who undergoes labor will understand what labor pain really is. So, to understand the suffering of others, you have to undergo suffering to be able to correlate with others. And that correlation is compassion. To understand the suffering of your patients, you have to understand what suffering really means. You have to connect with them with compassion. So compassion is something which you cannot do away with. If you want to be healers, not just treaters, you have to understand what compassion is. So there are three basic components to what compassion is all about. First is to recognize suffering. To be able to recognize suffering, you have to undergo suffering. And all of us anyway are undergoing suffering. Second is to relate to individuals in suffering, to connect to those individuals who are in suffering. And third is to react to suffering. How do you react to suffering? By showing your compassionate presence. By trying to relieve the suffering. Now this is just an example. This is our hospice. We have a hospice in rural Jharkhand. And this gentleman who is lying on the bed, his parents had abandoned him near a local temple. He was with advanced malignancy and somebody had brought him to our hospice. And that gentleman who is sitting on the chair, an elderly gentleman, he was also staying in our hospice. He was literally a vagabond. And this was the day of Holi. On the day of Holi, everybody is playing with colors. But this elderly man, on the day of Holi, he chose to sit by the bedside of this gentleman and feed him biscuits. These little acts are the acts of compassion. These little acts are the acts of divinity. This is what godliness is all about. It is not doing big researches in big laboratories and publishing papers. No. This is where it begins. This is ABC of compassion. This is ABC of good medicine. This is what you need to learn. This is what needs to be inculcated in your medical practice from day one. If you cannot demonstrate compassion, you can never be a good healer. So how do patients view compassion? They say, yes, compassion is so very important. If you look from a patient's point of view, what do they want from doctors and nurses? They want compassion from doctors and nurses. And what do doctors and nurses have to say about compassion? They also say that it is very essential. But you see, I don't have the time. If I show compassion in all my patients, how will I finish seeing my patients? These are all excuses. And then comes something called dignity. Now, dignity is closely related to compassion, because dignity comes from the Latin word dignitas, means worthiness. Am I worthy? What is my worth? So it comes from the Latin word dignitas. So it is an inherent quality of a person which is inviolable. You cannot violate it. Now just reflect back how many times in your practice during examination of a patient, be it a male patient or a female patient, while removing the clothing of the patient, how many times have you taken the permission of the patient? How many times have you ensured adequacy of privacy while examining a patient? How many times before inserting a IV infusion or putting in a Ryle's tube, did you talk to the patient and respect the choice of the patient? These are little things which are the hallmarks of dignity. So dignity, please do not forget, even the poorest of the poor has the wealth of dignity. Please preserve that wealth. So are we really ready? With the existing system of medical education worldwide, are we really ready? Would you love to die in a hospital? Would you like to spend the last days of your life in a hospital or at your home? And if the choice is that you would like to spend the last days of your life at home, then definitely there is something wrong with the existing medical education system. Because of the dominance of the biomedical model, we are just taught about biology, physiology, and how to treat different conditions. What we need is the holistic system, bio-psycho-social model of care. That is what we need. People talk about it, but people don't implement it in the basic process of medical education. And then there are so many barriers. You can, say that there are so many barriers to providing dignity therapy or compassion. So in physicians there is burnout. I will not talk about it, it's a lecture by itself. Burnout. How many of you are burnt out? You won't even understand what burnout is. It is the elephant in the room, it exists. But you don't want to acknowledge it. Every day you are facing symptoms of burnout. Irritability, anger, hypertension, not being able to sleep, cursing the boss, he is not giving me promotion, you see, worthless fellow. So many issues are there. Burnout, external distraction, difficult patients and so on. Negative workplace culture. Your friends will say, what the hell, you are talking to patients, you are wasting your time. Huh? And nothing good will happen to this institution. This hospital is doomed to, doomed to not to survive. So these negative attitudes also, these are all hallmarks of burnout. And ageism. As long as you talk of ageism, that, oh, this is an old man, he is probably demented, he cannot take decisions, let me take the decision for him. So as long as these type of ideas are there in your mind about ageism and all, you cannot talk about dignity. So this was a survey done in the United States where they found that 71% of the people, they expressed preference to die at home. This was in the US. And 49% believe that most patients lack control. Right? So nobody wants to really die in a hospital. Because why? There is no dignity. There is lack of compassion. Although there might be physical care, you are giving ICU care, you are giving ventilatory care, but at the bottom of it, we don't want that. Patients don't want that. What patients want is dignity therapy, compassionate care. This is what the needs of patients are, and all these studies point to that direction only. But we as doctors, as healthcare professionals, as nurses, we are driven more by financial concerns, driven by the corporate hospitals, driven by the pharmacy industry. We don't want to look that side. We don't want compassion. But tomorrow when you become a patient, you want compassion for yourself. You want dignity for yourself. That is the paradox. So cultivating compassion. Compassion is something inbuilt. It is like an inbuilt software in a system. But some aspects of compassion, like good communication, etc., can be taught. So that is the good side of it. This is me. This was taken almost 5 years back. I was hospitalized in Indraprastha Apollo, New Delhi for a short period of time. And when I became a patient, that is when I understood what dignity was all about. I did not like it when the nurse used to come at 2 o'clock in the night to take a blood sample. Why should you come at 2 o'clock in the night? Because that is your shift duty. You are coming at 2 o'clock, you are disturbing my sleep just to take a blood sample. And not once, 3 to 4 times they are coming to take blood samples. It hurts. It hurts. A venipuncture hurts. But nobody is bothered. They won't even ask you. They will just open the door, barge in, tie a tourniquet and then start doing their business. That is when you realize how important dignity is all about. How important compassion is all about. So think about it. So many guidelines have been given by different bodies about patient-centered care, end-of-life care, how it should be done. I won't go into the details. We talk about it in conferences and that's the end of it. We do not implement it into our daily practice. And if that is not happening, then this whole system is useless. These two gentlemen, you recognize them? See that gentleman, your ex-principal, and this gentleman, he will come now. Both of them had come to Jharkhand, to my rural hospice, and they went with our home care teams, they went down to the villages. But what were the difficulties that they had faced? Communication. Communication is so very important. Language barriers, social barriers, cultural barriers are so very important. So you imagine when those patients who come from the northeast or from UP or from Bihar, when they come down to, say, for example, CMC Vellore for treatment, they don't understand the local language. It's a totally different culture. You see, they come and then they get stuck. So where is the dignity? Where is the compassion? So we need to respect the local cultural practices, the local social practices. So it is not very easy just copying a model of care and trying to paste it somewhere else in the country really will not work. It has to be culturally appropriate and socially acceptable. Those are the very important things. of course, Dr. Babu and Mr. Menon, they did a wonderful job of, as a part of, we all went as a team, and then they, discuss things with patients, with an interpreter. They did a wonderful job about it. But then they are seasoned palliative care professionals. They know how to go about it. But what I really want to say is how dignity is linked with compassion and how it can be linked with cultural and social preferences. So addressing cultural diversity is so very important. We need to address this issue as well. And suffering seeks validation. As I said, all of you are suffering. But if I ignore your suffering, then the whole game is lost. I have to validate your suffering. I have to say, yes, I understand that you are suffering. Only then that suffering has a meaning. If you are crying for any reason, your boyfriend has left you and run away, and you are sitting in a room and crying and crying and crying, nobody is bothering to even acknowledge your crying. It hurts even more then. You need somebody to come and comfort you. That is acknowledgement. So whenever you see somebody in suffering, please acknowledge that suffering. That takes away the pain. You don't have to do very many things. You don't have to give medicines. Just sit by the side of the patient or the person, talk to them, acknowledge their suffering. So there are various frameworks for holism. I won't go into the details because of the lack of time, like dignity therapy, spiritual care, meaning making. These are all chapters by itself. So compassion, you see, it is not a luxury. It is an essentiality. Thank you. I think I'll stop here.